If you've got a heart condition, just the thought of going to the dentist can be a little scary. And that's totally understandable. But here's the thing, avoiding the dentist is definitely not the answer, especially when we know that good oral health is so closely linked to good heart health. The great news is, it really doesn't have to be a stressful experience. So we're going to break down exactly how your dental team works to make sure every visit is a safe one, starting with the biggest question on your mind. So this is the big one, right? If you have a heart condition, is it actually safe to get dental work done? Well, the short answer is yes, it is absolutely safe, but only when the right precautions are in place. So let's dive into exactly what those precautions are. Okay, so what is the actual challenge here? What's the main thing we're trying to manage when you're sitting in that dental chair? Well, it all comes down to one thing, managing your heart's workload during the procedure. And this right here, this gets to the absolute heart of the issue. Any kind of stress or anxiety, the stuff you might feel at the dentist, it makes your heart work harder. That increases its demand for oxygen. Now, if your coronary arteries happen to be a little narrowed, the supply of oxygen just can't keep up. It's this potential mismatch, high demand, low supply, that is the one central problem your dentist is working to prevent. Now, to really get why all these safety protocols matter so much, it really helps to understand two key medical events. Knowing the difference between what we call angina and an actual heart attack is just crucial, not just for your own health, but for understanding why your dentist does what they do. Okay, there's a key word we need to understand here, and that word is ischemia. All it means is a temporary traffic jam for your blood cells. When blood flow to the heart muscle gets restricted, it's not getting the oxygen it needs to do its job properly. And that one concept is the key to everything else we're going to talk about. So this is where it all comes together. Look at this. With angina, that ischemia, that traffic jam, is temporary. Yeah, it causes discomfort, but the tissue isn't permanently damaged. A heart attack, or myocardial infarction, that's when the ischemia goes on for too long. It causes irreversible cell death and leaves permanent scar tissue. And that's the whole game right there. The goal of every single safety step is to make sure that first thing, that temporary ischemia, never even starts. So how do we prevent it? Well, it all starts with what we're calling the pre-procedure playbook. See, a safe dental visit doesn't just start when you sit down in the chair. Nope, it starts way before that, with a really careful assessment. Think of your dentist as a detective. They need clues about how stable your heart is. They're going to ask questions just like these to build a really clear picture. Like, is your angina predictable? Does it only pop up during heavy exercise? Or is it unstable, maybe happening with just a little effort or even when you're resting? Your answers to these questions are what determine all the next steps. So, after you've had that talk, a very careful process begins. If your angina is stable and well managed, it's usually totally fine to go ahead with treatment. But if there are any signs that it's unstable, like your chest pain is getting worse or it's unpredictable, then any non-emergency procedures will be postponed until your doctor gives the all clear. Because at the end of the day, safety is priority number one. Always. All right, so you've gotten the green light for your treatment. Now what? What actually happens during the appointment to keep you safe? Well, this is where the in-office safety protocol kicks in. The number one goal here, the whole point, is to keep your heart from working too hard. And how do we do that? By managing anxiety. Getting you profoundly numb is job one. If you don't feel pain, you're way less anxious. They'll also keep a close eye on your vitals. They might offer you something like nitrous oxide to help you relax, and they will always have your nitroglycerin ready to go. Plus, they'll keep talking to you, just to make sure they know how you're feeling moment to moment. Okay, this is a big one. We hear this question all the time. You've probably heard of epinephrine or adrenaline, right? The stuff that can make your heart race. So it's totally natural to wonder, hey, is that stuff safe for me? Let's take a look. It's really a balancing act. See, the benefit of using a little bit of epinephrine is actually huge. It makes the anesthetic work better and last longer. And better numbness means less pain, which means less anxiety, and that means way less stress on your heart. The risk is completely manageable as long as your dentist uses a careful, proper dose. For most patients, that benefit of being completely numb is way more important than the risk. And look, this isn't guesswork. There are very, very specific safety limits. Dentists are trained to use no more than 0.04 milligrams of epinephrine in any 30-minute period for a patient with significant cardiovascular disease. That is a tiny, tiny amount, and it's super carefully controlled to give you all the benefits without the risk. So, we've talked a lot about what your dentist and their team do, but you know who the most important person on that team is? It's you. Your active participation is absolutely critical for a safe and successful visit. Really, it all comes down to being a partner in your own care. So be totally open about your medical history and every single medication you take. Be honest about how anxious you are. They can't help you manage it if they don't know it's there. Always, always bring your personal nitroglycerin with you. And maybe most important of all, be vocal. If you feel anything at all that seems off during the procedure, you have to speak up right away. You know, this quote right here, it just sums everything up perfectly. When you get right down to it, the increased oxygen demand, that stress on the heart, it's mostly caused by patient anxiety. By understanding the process, communicating openly, and just trusting the protocols, we can keep that anxiety and therefore that demand on your heart way down. So, after going through all of this, what's the one thing you're going to take with you to your next appointment? Maybe it's asking, so what's our plan to manage my anxiety today? Because remember, being an informed, active partner in your own care, that is the most powerful tool you have. Period.